Stroke doesn't announce itself. It often strikes quietly, and morning hours are the most dangerous. Research from the American Heart Association shows nearly half of all strokes happen between 6 a.m. and noon, right when blood pressure and heart rate fluctuate the most. For adults over 60, this timing is even riskier because the body clears medicine more slowly. The liver and kidneys can't filter drugs as efficiently as they once did, leaving side effects to build up overnight. That's why a pill you take before bed may still be working, or working too strongly, when the sun comes up. Ignoring these shifts is more than a small oversight. It's a gamble with your ability to walk, to remember names, and to stay independent in your own home. Protecting yourself starts with understanding these hidden patterns. And the first step is recognizing that even everyday medications can quietly shape your morning health in powerful ways. Number 1. NSAIDs, the silent blood pressure trap. Pain relievers like ibuprofen or naproxen are common choices for joint stiffness, arthritis, or back pain. But when taken for weeks or months without careful monitoring, these pills can slowly raise hidden risks. Research published in the BMJ 2020 found that long-term or high-dose NSAID use increases blood pressure by 3 to 5 millimeters of mercury. For someone over 60, even a small rise can tip the scale toward a stroke, especially if high blood pressure or heart disease is already part of the picture. The problem isn't one tablet, it's the steady buildup over time. Day after day, the strain on your arteries and brain grows, often without symptoms. That's why older adults are more vulnerable. Slower kidney and liver function means the drug lingers longer in the body. The good news? You don't have to give up pain relief. Talk with your doctor about safer options or set clear limits on how often you use NSAIDs. At home, keep a simple habit. Measure your blood pressure once or twice daily for a week whenever you start or increase these medicines. This small step gives you early warning and protects the freedom to stay active, mobile, and independent. Number 2. SSRI and blood thinners. A dangerous combination. Antidepressants like sertraline or fluoxetine, known as SSRIs, are widely prescribed and often very effective. On their own, they are usually safe for older adults. But when combined with blood thinners such as aspirin or warfarin, the risk of bleeding rises sharply. A JAMA Network study in 2021 showed that during the first 3 months of this combination, the chance of a major bleed increases by 42%. For someone over 60, even a small internal bleed can quickly become life-threatening, especially in the stomach or brain. The risk is highest when your heart medication plan changes, for example, after starting aspirin for the first time or adjusting a warfarin dose. That's why this overlap demands careful attention. If you're taking an SSRI alongside blood thinners, don't stop suddenly, but do keep your doctor informed of every prescription and over-the-counter pill. Look out for warning signs: unusual bruising, nosebleeds that take longer to stop, or dark stools. A simple blood test ordered by your physician can catch early trouble before it becomes an emergency. Remember, staying independent isn't just about avoiding falls. It's also about preventing hidden internal bleeding that could rob you of strength and mobility. Number 3. Long-term benzodiazepines, falls. That change everything. Medicines like diazepam or lorazepam are often prescribed to ease anxiety or help with sleep. They can calm the mind in the short term, but when taken for months or years, the risks quietly add up. According to AHA Journals 2022, older adults using benzodiazepines long-term face a 1.5 to 2 times higher chance of falling. And for someone over 65, a fall is rarely just a bruise. It can mean a hip fracture or a head injury. One fall in the bathroom at night, for example, can take away months of recovery time or even independence altogether. Head trauma in seniors is especially serious because it dramatically raises the risk of death after a stroke. This turns what seemed like a simple sleep aid into a trigger for life-changing consequences. It doesn't mean you must stop these medications overnight. Sudden withdrawal can be dangerous, but it does mean you should talk with your doctor about safer alternatives, such as behavioral sleep strategies or non-sedating options. At home, small changes can help too. Keep hallways well lit, remove loose rugs, and use stable shoes instead of slippers at night. By protecting your balance and your brain health today, you give yourself the best chance to stay active, confident, and in control tomorrow. Number 4. Diphenhydramine at night. Hidden risks in a common pill. Many people over 60 keep over-the-counter cold or allergy pills on the nightstand. Diphenhydramine, often labeled as a nighttime sleep aid or allergy relief, is one of the most common. It seems harmless because it's sold without a prescription, but long-term use tells a different story. A JAMA Network study in 2019 showed that frequent diphenhydramine use can lead to dry mouth, confusion, and dehydration. These may sound minor, but for older adults, confusion can increase the risk of falls, and dehydration can raise blood pressure or trigger dizziness. Even more concerning, research signals a link between heavy, long-term use of diphenhydramine and a higher risk of dementia later in life. This doesn't mean every pill is dangerous, but it does mean awareness matters. If you find yourself reaching for it night after night, pause and ask, is this becoming a habit? Safer approaches include keeping a consistent sleep routine, limiting caffeine in the afternoon, or trying non-sedating allergy options. And if sleep problems continue, a conversation with your doctor can help tailor solutions without the hidden cost to memory and independence. Remember, protecting your mind is just as important as protecting your body because both are key to staying sharp, mobile, and free in daily life. Number 5. Sulfonylureas at night, the hidden blood sugar drop. Medicines like glyburide or glipizide are often prescribed to manage type 2 diabetes. They help the body release more insulin, lowering blood sugar. But when taken in the evening, these drugs can trigger hidden dangers while you sleep. A study in JAMA Internal Medicine 2018 found that older adults using sulfonylureas at night faced a significantly higher risk of overnight hypoglycemia, sudden drops in blood sugar that you may not even feel until it's too late. Low blood sugar during sleep can cause night sweats, confusion, or in severe cases, loss of consciousness. Even more concerning, these nighttime episodes are linked to a greater chance of heart complications. For those over 65, glyburide is especially risky because the body clears it more slowly, letting the drug linger into the night. This combination, slower metabolism and fragile heart health, makes nighttime dosing a double threat. The solution isn't to stop your diabetes treatment, but to adjust wisely. Ask your doctor whether a different schedule or a safer medication is better for you. Keep a small snack by the bedside if needed, and check your blood sugar before going to sleep when starting or adjusting doses. These small steps help protect both your heart and your independence, ensuring you wake up steady and ready for the day ahead. Number 6. Levothyroxine overdose, when more becomes dangerous. Levothyroxine is one of the most commonly prescribed medicines for thyroid problems. It replaces the hormone your body may no longer produce in enough amounts, helping with energy and metabolism. But for older adults, the line between the right dose and too much is very thin. A PubMed study in 2020 found that adults 65 and older taking higher than needed doses had double the risk of developing atrial fibrillation, an irregular heartbeat. Atrial fibrillation may sound harmless, but it makes the chance of a stroke 5 times greater. What's tricky is that symptoms of an overdose, like a racing heart, anxiety, or poor sleep, can be mistaken for normal aging or stress. That's why routine monitoring is so important. A simple blood test can show whether your thyroid levels are truly in balance or whether the dose is tipping you into risky territory. If you're already on levothyroxine, never adjust the dose on your own, even if you feel more tired or sluggish. Instead, talk with your doctor about regular thyroid checks and ask whether your dose is still right for your age. Protecting your heart rhythm today is one of the best ways to guard your brain and independence tomorrow. Number 7. Hormone replacement therapy, weighing benefits and risks. Hormone replacement therapy, or HRT, is often prescribed to ease the hot flashes, night sweats, and bone loss that come with menopause. For many women, especially in their 50s and 60s, it can feel like a lifeline for comfort and quality of life. But science shows there is another side to this therapy. A JAMA Network study in 2019 reported that for every 10,000 women using systemic HRT over 1 year, about 8 additional cases of stroke occurred compared with those not on therapy. That number may sound small, but at a population level, it represents a serious added risk. The concern grows for women over 65, whose arteries and heart are already more vulnerable to change. Still, HRT is not all negative. It can strengthen bones, reduce fractures, and ease symptoms that disrupt sleep and daily living. The key is balance, weighing the relief from symptoms against the possibility of cardiovascular harm. If you are considering or already taking HRT, talk openly with your doctor about the lowest effective dose and the shortest safe duration, and ask whether non-hormonal strategies, such as weight-bearing exercise, vitamin D, or safer medications, might also support bone and heart health. Because protecting independence means not only reducing discomfort today, but also guarding against life-changing events like stroke tomorrow. Connection, small pills, big consequences. By the time we reach 65, everyday medicines no longer act the way they once did. The body processes drugs more slowly, safety margins shrink, and the chance of dangerous interactions multiplies. That's why familiar pills, the ones we've trusted for years, can suddenly carry new risks. A simple sleep aid can raise the odds of a fall, turning into a hip fracture and months of lost mobility. A routine blood thinner combined with another medicine can trigger bleeding that lands you in the hospital. An over-adjusted thyroid pill can spark atrial fibrillation, which multiplies stroke risk fivefold. These aren't rare, dramatic events. They are the quiet consequences of small oversights, the kind that build up until one ordinary night changes everything. What feels minor today, like a little dizziness, an unexplained bruise, or a racing heartbeat, can be the first signal of something much larger. The good news is that awareness gives you power. By noticing patterns, asking questions, and reviewing medicines regularly, you can stop these hidden risks before they turn into life-altering crises. Because the real goal isn't just adding years to life, it's protecting the freedom to walk, to think clearly, and to live each day on your own terms. Don't let today's small oversight become tomorrow's heavy burden for you or your family. The medicines sitting in your cabinet may look ordinary, but after age 65, they can quietly shape your future health in powerful ways. That's why taking action now matters more than ever. Here are 3 simple steps to start this week. First, schedule a check-in with your doctor or pharmacist to review every pill you're taking, prescription, over-the-counter, or supplement. Second, if you begin a new NSAID for pain or an SSRI for mood, monitor your blood pressure at home for the first 1 to 2 weeks and write down the results. Third, Take a fresh look at your nighttime medicines. If your allergy or sleep aid contains diphenhydramine, ask your doctor about safer alternatives that protect both memory and balance. These actions are small, but together, they add up to real protection for your independence, your confidence, and your peace of mind. Because the goal isn't just living longer, it's living well, staying sharp, and enjoying time with the people you love. If you found this guide helpful, please subscribe to the channel so you never miss future health tips built on trusted science. And remember, this content is for information only, not a substitute for medical advice. Always consult your healthcare provider before changing your medications or daily routine,